Hi everybody, Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna. Today I'm talking about hypermobility of the joints, and some of my patients have hypermobility, which means the joints are moving too much. There's too much laxity or looseness in the joint, causing the joints to shift around and the bones to shift around. For example, in the spine, there's ligaments, like in the front part of the spine. This is a side cross section of the spine. There's a front ligament called the anterior longitudinal ligament. We call it the ALL for short. And then there's the posterior longitudinal ligament, PLL. And then there's the discs in between the bones. And then there's ligaments, ligamentum flavum, behind the vertebrae, close to where the nerves exit, these foramen right here. Now these ligaments hold the bones together. Here's another one here in yellow, the supraspinous ligament right there on top of the spine. So these ligaments hold the spine together and give you integrity or strength in the spine. Now most people, I would say, have tight ligaments and tight muscles, not allowing proper mobility and function of the spine. But then there are people that have too loose ligaments, and they might have that from an injury. They might have it from an inflammatory systemic type of condition like rheumatoid arthritis. And what can happen is the ligaments are not as strong as they should be, and then it causes the bones to shift around too much, which can result in pinched nerves and pain and discomfort. Now this can happen in the knee as well, and here's a cross section of the knee from the front. You see the anterior cruciate ligament right there, the posterior cruciate ligament in the back, the lateral collateral ligament on the outside part of the knee, and the medial collateral ligament right here on the inside part of the knee. So often for athletes, these are ligaments that are injured or they've been stretched and torn, and there can be ligamentous laxity of the joint as well in the knee, causing a shifting and popping of the knee. So as a chiropractor, what we want to do is first assess the posture and the alignment of the joints. We want to do adjustments to realign the joint. We want to make sure that the joint has the proper function. So we want to make sure it has the flexibility. But then in cases like this, we want to increase the strength of the joint by giving the patient certain exercises to do to strengthen the ligaments and the tendons that go over the joint. The tendons are much more strong than the ligaments because they're a lot thicker. So we want to strengthen the muscles and then the attachment of the muscle into the bone, which often crosses a joint via a tendon. And by strengthening the tendons, the muscles, giving the joint more integrity, it'll help to keep the joints in the proper place. So we do have patients with hypermobility, we do have patients with hypo or too stiff, and we want to deal with those conditions accordingly depending on that individual's unique circumstances. If you are in Kelowna and you're looking for a chiropractor, we are accepting new patients. Click on the link below and you can go to our website to book an appointment or call the number on the bottom of the screen. If you're not in Kelowna and you're looking for a chiropractor, we'd be happy to help you. Just message us, DM us, or write a comment and we'll get back to you.